Cheryl, thank you for being here tonight, sis. Tell me who you are, and what it is that you do.
I am a pharmacist, practicing pharmacist since 2008 for, 12 years now, and graduated from Howard University. I have a doctorate of pharmacy and an MBA, and I'm a registered pharmacist in Maryland.
So let's just get to the chase. So COVID-19 is still happening. It is still impacting our community. The pandemic has not yet been declared over. We are still working very diligently to flatten the infamous curve. We are aware that the country and certain areas are reopening. And I'm grateful to you because a lot of people, Cheryl, even myself as a nurse, pharmacology was one of my most difficult classes that I had to take because there are millions of drugs out there, and it's almost impossible to know every single drug and what the interactions are and how it impacts your body. And yes, HU to all of the people, Cheryl, on our comment section. I'm looking on our phone. Everybody's saying HU. So yes, you have two Howard graduates that are on here sharing. Oh, and full disclosure, neither one of us are here as representatives for any of those organizations. Cheryl is here specifically and on her own personal information as a educated pharmacist, as well as myself. I am simply here as an educated nurse and a nursing leader, not representing any organization. We are just giving you our own personal and professional and educated opinions from what we see that is happening. The numbers tell the story, and I've been saying that quite often. So currently there are 1,480,000 positive cases in the United States, 89,407 deaths. So we basically are at 90,000 people that have passed away, and almost 1.5 million cases in the United States. This information comes directly from the cdc.gov website. Please feel free to go there to fact check. And I also wanted to share within the last 24 hours, Dr. Gilbreth, there has been 13,000 positive cases, and there has been over 698 deaths just in the last 24 hours. So Cheryl, back to you as a pharmacist. What are your thoughts on hydroxychloroquine? Why should someone take it? What are your thoughts as our leader indicated that he is now taking the drug over the last week or so? What does that mean?
It means that because President Trump is making these statements, it is a global effect that we really do not even realize. First of all, do not take hydroxychloroquine unless your doctor specifically prescribes it for you. Do not take that drug. There are so many side effects, adverse events that you would not even want to know about unless you are literally talking to your healthcare provider. Bottom line, first of all, the effect that Trump's statement is making on a global level, I've seen a lot of comedy happening. A lot of people are just laughing it off because you and I and a lot of people who are probably listening right now know better than to listen to President Trump and anything that he says seriously. But on a global level, unfortunately, a lot of people are taking whatever he says as truth. And unfortunately, I have found some articles that are reporting deaths due to hydroxychloroquine overdoses from people who are obtaining the drug without a prescription. They're getting it black market or obviously on their own without having a healthcare professional prescribe it. So
Dr. Gilbreth, share with me first of all, what is hydroxychloroquine as a pharmacist? Break it down for us. What is the impact of hydroxychloroquine on just a normal, legitimate, prescribed perspective? What is the drug and what is it used for? So people are clear.
Okay, hydroxychloroquine, its brand name is Plaquenil. It is approved by the FDA as an anti-malarial drug. Okay, and uses for rheumatoid arthritis and lupus. Those are the FDA approved uses. Let's just get to the side effects. I want to make sure that you guys have a bit of alarm in your mind when you think about taking medications in general. You don't want to take these willy-nilly unless you have a professional prescription written specifically. Side effects can, at the worst, be death, like I just mentioned, overdoses of more than 800 milligrams at a time, or even more over a long period of time if you take it on a regular basis. It's anything above 600 milligrams is very
What's a
alarming.
normal prescribed dose for malaria?
Okay, the normal prescribed dose is, depending on the indication, depending on the disease you're trying to treat. I'll say in general, they start at 400 milligrams as a loading dose, and then they would have a 200 milligram daily. That would be for malaria. And as a prophylactic, for example, you want to take it daily up until a few weeks after you return from wherever you've been traveling.
So I think that's important to share too, Cheryl. Just kind of put a pin there for a moment, is that when you take hydroxychloroquine, if you are an international traveler and you're going to a place that unfortunately still has malaria outbreaks, people need to understand what loading doses are and what prophylactic doses are. So your loading dose is your initial dose that you need to take when you are starting your medication. And then sometimes you you're weaning down on the number, or sometimes it can go up based upon what the medication is. And so what Dr. Gilbreth is sharing for those laymen out there is that typically if you are going to said country that has malaria, a lot of people have to then make sure that you are building up your system prior to going to where you are so you don't get malaria. It's important to realize that the physicians also have to take into account any of your other underlying pre-existing conditions that you might have. You know, if you have liver failure, kidney disease, or something of that nature, any of these other medications can impact that. If you're a person who's on dialysis, you definitely have to be very keenly aware of what medications you are taking, because that dialysis machine that you go onto 3 times a week and or daily, if you're doing your own peritoneal dialysis, has to filtrate your blood system. And that people don't really realize the impact of not just hydroxychloroquine, quite frankly, any medication. So
Absolutely correct. As you mentioned, comorbidities or pre-existing diseases are probably the most important thing you want to know about, especially when taking hydroxychloroquine. For example, if you are a diabetic and you're taking insulin, hydroxychloroquine can cause you to have a hypoglycemic reaction. Also, more alarming are all these other drug interactions that could cause arrhythmia.
and arrhythmia is don't forget,
Arrhythmia,
don't forget, you're talking to me. I know what it is, but those people watching are like, what's an arrhythmia?
what is it?
What's that?
Arrhythmia is basically irregular heart rate.
Correct.
And it could either cause it to slow or make it go too
Too
fast.
fast. When I was in nursing school and I started out and I worked in the emergency room, the nurse educator, Cheryl, said there's 3 rhythms: too fast, too slow, and oh my God. So
Yeah,
make sure you understand. So those arrhythmias that you're talking about definitely have an impact. Again, like as you indicated, you don't want to take a drug and then make your heart race too fast and or your heart to slow down and you're not getting perfused. The blood is not perfusing either way. If it's too slow or too fast, your body is not being perfused appropriately.
exactly. So if you're already on medications for, say, heart failure or blood pressure, like amiodarone, or if you're taking, and this is one thing that I really did not like. I didn't like anything that he said, but the fact that he said he combined hydroxychloroquine with Zithromax, that is probably the worst thing to do, because there are a lot of antibiotic drugs that also cause arrhythmia. And combining them will obviously enhance the effect and actually put you at greater risk for irregular heart rate that could cause to heart failure or anything that is an emergency.
Absolutely.
So, and I'm talking about several different types of antibiotics, not just Zithromax. There are ciprofloxacins, there are the quinolones, any antibiotic. Let's just leave it at that. Also antifungals, so the azoles like miconazole or itraconazole.
And
Those,
what type of drugs are those prescribed for? So for the
okay,
layman out there, if you have a pneumonia or if you have a yeast infection or
there's
um,
chlamydia.
most people have heard of the infamous Z-Pack, you know, and is this the Z-Pack that you often get when you think you have a cold or the flu and you go and the doctor is not sure, they might give you that infamous Z-Pack. All of that combines, it's called what we call polypharmaceutical, where you're mixing all these different medications, and polypharmacy can be very, very dangerous if you're not sure of what you're doing. Talk to me about the impact. If you said earlier when you first started that people are seeking to now get hydroxychloroquine on the black market, how does that happen? And what would happen? And what is the impact about if that gets to the wrong person? What is the outcome?
Well, like I said earlier, the worst outcome can be death, or it could be a drug interaction that could cause an emergency like arrhythmia, or it could also cause just any kind of adverse event that you're not even expecting because that person who obtained the drug without a prescription, without a prescription, that there is nobody there, there's no healthcare professional there to assess that person and their health records. Nobody else is able to take a look at the patient's drug history, like if they are a
That
diabetic.
med reconciliation that we do often in the hospitals, absolutely.
Yeah. So and the impact, actually the article that I saw was reported last month, well, the end of March. So the idea of hydroxychloroquine has been around for a minute. They are using it only for emergency situations for patients who are in definite need for it in a hospital setting, in a very controlled clinical setting. They're
I
not.
think that's key. I think you need to repeat what that means. In a hospital acute care setting where you are actively monitored. Someone had a question. Hey, Elder Martha, she said, what about taking it in with blood thinners?
I would not recommend taking it with anything if you can. Definitely need to talk to someone who is more intimately involved with your health. Talk to your professional physician. Um,
Correct.
because right now, what I see, I don't see anything specifically discussing blood thinners like aspirin and things like that.
The other comment, they were talking about a clinical trial of hydroxychloroquine and zithromycin to treat COVID-19 patients where adults are being enrolled with mild to moderate basically symptoms in the US. But that, you know, and to Yvette's point, thank you, Yvette, for that comment. I think what people need to understand is, again, mild to moderate symptoms, and what might be mild or moderate to me with no past medical history, et cetera. And you are able, you know, I think I have fairly good lung functioning. That's why I still continue to try to work out and run and exercise to keep that up. But if you have other multiple comorbidities and you're diagnosed with COVID-19, it definitely has a completely different scenario. So I think the key for all of this is, you mentioned earlier, Cheryl, you know, my concern regarding what our president has shared is just when you make a blanket statement without important follow-up to say, as you just said, do not take it with anything would be your personal recommendation, but follow up with your primary care physician or your medical provider who is intimately, was your key word, intimately involved with your care, because he or she is now following and tracking you.